Hey there, Empowered Tribe. It's Angela T. Moore. You're getting ready to experience the third episode of Empowered, a health and wellness podcast where I share my personal journey of health and healing, tips for mental and physical health, interviews with health and wellness experts, and those bold enough and vulnerable enough to share their own journeys to empower you to succeed in yours. We know that life can be rewarding. It can also be challenging. It has its ups and downs, highs and lows. I learned that with a strong mind and a fit body, you are better able to grow through and grow from whatever life throws your way. My goal is to share journeys of health and wellness, as well as tips and information from extraordinary people all around the world to help you live an empowered life. My guest, Cal Ingraham, serves as HAP's Manager of Medicare and Individual Sales. A respected leader in his field, Cal's professional focus lies in the realms of Medicare, market strategy, and sales. He currently holds the position of Vice President at the National Association of Benefits Insurance Professionals Metro Detroit chapter and serves as a board director for the Lakes Area Chamber of Commerce. He is also a distinguished alumnus of Leadership Oakland. Cal is driven by a desire to leave behind a better world for future generations and to honor the legacy of those who paved the way for him. In this episode, Cal shares tips and key information for those individuals that travel to warmer climates during the winter months. In an effort to make sure that snowbirds are covered, Cal shared how HAP and insurers provide health coverage options for individuals and their caregivers. I hope you enjoy the episode. Cal, we know Michigan winters can be tough, and for a long time there has been this trend of snowbirds, which are people of retirement age who flee the cold during the winter months for places like Florida, Arizona, and other places with warmer climates. But something that doesn't get talked about as much are the potential problems when these travelers experience a health event and they're not in their home state and need to utilize their insurance coverage. Can you talk about some of the options for snowbirds who experience a health event while they're not in their home state?
Absolutely. And it is super important for people to know if you are traveling, if you're on original Medicare, a Medicare supplement, or a Medicare Advantage plan, we all have worldwide emergency coverage. So if something does happen, you have to go to the hospital in the event of an emergency, you do have coverage. But some of those may be limited to $50,000 lifetime or per year in coverage, and that can add up quickly. So that's important to take a look at your plan and know what type of coverage for emergency services there are. For example, a lot of Medicare Advantages plans, there are no max limits for those services. So you know that you can travel, and if something catastrophic does happen, you're not going to be stuck with a bill after you get over a certain amount of money. Where it becomes challenging is if they're going to see a PCP or a specialist. So the snowbirds, if they're going to be in Florida, which I can't say I blame them for getting rid of the snow every year, but if they're going to see a PCP or specialist while they're there, it's important to know how your plan is going to react for that. Some Medicare supplements, or almost all of them, are going to cover any Medicare provider. So they're going to be able to utilize that plan in any state, no matter what the provider is, as long as they accept original Medicare. Medicare Advantage plans, they're robust, and there's a lot of different benefits that go along with those, but that will change carrier to carrier how it will work in other states. For example, I can speak for HAP, whose Health Alliance plan that I work for. Our HMO plans allow for Florida, Texas, and Arizona for our members to see any Medicare provider at in-network cost shares. Some plans may partner with a national carrier to utilize their network when they're outside of the state. So it's important when a member is speaking with their agent to understand how that benefit is actually going to work for them.
Okay. Well explained. Thank you. Now, after listening to today's show, people that are looking to get away from the cold weather, but also wanting to make sure they are covered in the event they need health services, are going to be looking for options. How can insurers provide peace of mind for people who are looking to go on extended stays in warmer climates this winter?
So again, that is going to be a carrier by carrier basis. I can speak for HAP. We work very hard for our members to make sure that they're going to be able to receive the services that we're promising them, in their summary benefits and their evidence of coverages. We encourage all of our members, if you are traveling to another state for an extended period of time, to give us a call, let us know who those providers are, and we'll do outreach for them. Let them know that, yes, there is coverage, this is what their cost shares are, and how that provider can bill us to ensure that they don't run into difficulties when they're in that snowbird state, as you would call it.
Snowbird state. I would like to go to a snowbird state right now. Now, HAP is an insurer that primarily operates in Michigan. So how does your coverage kick in when your members need to utilize it out of state? I'd like you to kind of expand on that more. I think you kind of touched on it, but can you expand more?
Exactly. So it depends on the product. On our Medicare supplement plans, any Medicare provider in the United States, they can go ahead and see. On our Medicare Advantage, our PPO plans, they can see any Medicare provider in all 49 states outside of Michigan.
Awesome.
The HMOs, because that is a more, I don't want to say narrow network, but it is a defined network. They can go see any Medicare provider in Florida, Texas, and Arizona. And actually what they don't understand is outside of our service area in Michigan, they can also utilize that benefit. So we're not up north right now. Michigan's a different state. We have snowbirds in the winter, and we have people who like to go up north in the summer.
Right.
They can utilize that travel benefit as well when they go up north in the winter or summertime.
Okay. You know, I always laugh when people say up north because no one ever says like what up north actually is, like what particular city they're going to. They just say up north. Have you noticed that?
Yeah, I have. I'm not originally from Michigan, so I'm just catching the lingo from everybody when I was here.
Well, I've been here only since 1992, and I still don't know exactly what up north technically means. So I always think that's really funny. Now, partnerships allow organizations to extend their reach in the services that they provide. Do you have partnerships? And you may have touched on this, but again, I want to make sure that I give those listeners the opportunity to really get the information that they need to make key decisions. Do you have partnerships in place to ensure that your members receive quality coverage when they're not in Michigan?
So again, that really depends on the situation where they're going. We have great options and partnerships for them no matter what, but it may be a different trigger. So if they are within the United States, obviously we have our travel benefit that's going to help them out. And then obviously our partnerships with Delta Dental for dental, if they're going to be in one of those states and need to receive services, they can utilize the travel benefit in those states as well to make sure they can see a provider. What's super important is when you're traveling, especially abroad, you have a lot of people leaving the country. Sometimes they're going down, I feel like more and more we see Puerto Rico, Mexico, people are going to Snowbird in those areas. And we have something called Assist America. That's a partnership we have. And that allows them, if they lost prescriptions while they're traveling, if something happens, they need help translating a bill when they come back in the States. If they lost their luggage, they need to get back to the United States if there's been a medical emergency. That service allows coverage for them to utilize those services while they're gone.
Okay. Yeah, you touched on a lot of things that I don't think people think about until they actually need to think about it. Yeah, so thank you for mentioning that. Now, we are sitting here with a couple days actually left in the annual enrollment period for Medicare beneficiaries. Can you talk to my listeners who still need to enroll about some of the considerations that they should keep in mind when it comes to their coverage if they're planning to spend an extended amount of time out of state?
Yeah, I think one of the main things you want to look at is the service of the company that you're working with. No matter what, when you're out of state, something may go wrong. There may not be something that goes the way that we plan. A provider may not bill the way that we want it to. So it's important to look for those companies who are taking care of the members and making sure that the service is there for them on the back end, that we're actively working for them. I mean, somebody like HAP, we're trying to do that proactive on the front end, make sure that we're doing outreach to those providers to start off. But not everybody calls us first, so sometimes we have to do it on the service side. The other thing is to make sure that they're looking at the plan design and where their travel benefit or outside of state coverage will kick in. So I mentioned our HMO is limited to a few states. Our PPO is all 49 states outside of Michigan. Excuse me. The other thing to look at is what type of travel are you doing? If you are RVing, which is something we see a lot of our seniors do, you're really staying short periods of time within each location that you're going to. So are you really going to see a PCP or a specialist, or are you probably going to emergency or urgent care? In which case that worldwide emergency and urgent care coverage would kick in, and it doesn't really matter what that out-of-state coverage is for PCPs or specialists. So it's really keeping in mind not just where you're going, what type of travel are you doing? Is it short stays and you're traveling across, maybe seeing family across the United States? Maybe your kids did to you what I did to my parents and moved to another cold weather state and doesn't help them out at all. You may be going there. So you want to make sure that you're looking at plans that have coverage for that specific area you're going to.
Okay. You know, I have to laugh when you say RVing because that's something that my husband and I said that we're going to do when we get older. We're going to buy an RV and literally go from state to state and go to all the states in the United States and really take advantage of quality time together, without all the distractions of the world.
Absolutely.
Now, on the subject of the annual enrollment period, we know it is not always the beneficiary that is making the selections, but a loved one or caregiver. How can caregivers leverage an insurance plan to help contribute to the health and well-being of their loved ones?
So the first thing I want to make sure is if somebody is out there, they're a caregiver, make sure you have that power of attorney or something else so that you can make those decisions for your loved one. The other part is take a look at what support services each carrier provides. For example, HAP has a service where if that loved one calls into customer service or member services, we're actually able to connect them to maybe a caregiver support group or some other association within the community that can help somebody who may be new to this. Because let's face it, not only is Medicare new for our seniors when they go onto that coverage, but especially if one of their kids are taking over it, they're used to being on a plan that HR has decided for them. They haven't really had to make healthcare decisions like you have to on Medicare. So being able to call into a company that can connect you with certain resources, that can provide you further education, and also look out for educational things for caregivers that some carriers will do in the community. So a lot of times, I know ourselves and a few of the others in Michigan will put on caregiver Medicare 101 seminars and make sure that you're understanding not just who you're placing the business with, but actually how Medicare works for your loved one and what you have to think about. If they're in a skilled nursing facility, if they need in-home care and all those different things is what you really want to be able to understand to make that best decision for your loved one.
Okay, you mentioned that information. How can someone access that information?
So for HAP, you can find it on hap.org under our events tab.
Okay.
We have a lot of different educational programs all throughout the year for both current members and non-members that want to just learn more. I would also highly suggest Googling, it sounds like a simple thing to do, but if you go on Google and you search, caregiver Medicare 101s, you're actually going to see quite a bit within the community. I would also invite you, a lot of our seniors will be receiving postcards. A lot of our independent agents in the area do Medicare 101s throughout the year. They're not going to tell you no to come to that if you want to go as a caregiver and take a listen, understand what they're saying, and try to educate yourself on what you're doing. We have a lot of fantastic independent agents here in Michigan that put on a lot of these seminars for people, and some of them are catered towards caregivers as well.
Okay, perfect. Now, what are some benefits and programs that insurers have that people may not know about that can improve a Medicare's beneficiary's quality of life?
So there's a lot of different ways you can look at that.
Yeah.
One is our care coordination team. A lot of carriers have care coordinators that actually can become another advocate for your loved one or yourself as a member to make sure, A, you're receiving the quality of care that you need. They're helping you maybe schedule your appointments. If you have a chronic condition like diabetes, they may be able to help educate you a little bit more in plain terms than maybe your provider is giving you. A lot of times they use big words and none of us really understand them.
Yeah.
So the care coordinators are actually able to talk through that in more simple terms so that everybody can understand what's happening. The other part is the support services that I'd mentioned earlier. When you call into a carrier and they're able to connect you with different resources in the community, that's extremely important. Now, I will heavily promote local carriers because we have a lot of those ties locally within the community. So there are regional carriers in Michigan that work with all of our different community partners throughout the state that we're able to connect loved ones, members, whoever it may be, with those resources.
Okay. Now, what's really interesting is every year we hear about the annual enrollment period. We start seeing the commercials on television. We hear the ads on the radio. Why does the annual enrollment period even exist?
So it's to protect both members and carriers.
Okay, explain.
So on the carrier side, it stops people from moving company to company to company, utilizing all the benefits on one plan, going to the next one, utilizing all the benefits on that plan, going to the next one. The other one is it protects the member from all year round getting phone calls, potential scams happening, getting moved onto different plans without their knowledge base. So when you have one set enrollment period, members know this is when I can enroll. I'm going to speak to my agent. And that's one thing I will promote heavily. If you have an agent you're working with, and somebody calls you and they tell you they're from Medicare, they're from the carrier, they need you to confirm this MBI number or something else. They are not from Medicare. They're one of these unfortunate call centers that are the bad actors that give Medicare the bad name a lot of times. So we want to make sure you're working with your agent and just hang up the phone if some random person calls you asking for Medicare information.
Okay. Can you expand on that a little bit more? Because I have heard about that in years past where that's an issue, where someone has been covered by a particular insurance program and someone has called them and actually tricked them to switch. So can you talk about that more? Because that is an issue that I've heard a lot about.
Yeah, and unfortunately, it's not even just they've been tricked into switching.
Yeah.
It's that they've maybe confirmed one piece of information, and that bad actor has just enrolled them into a plan. They never actually got confirmation. They didn't tell them it's an addition to your current coverage. They just enroll them into the plan, which is extremely unfortunate. It's something we notice trends in the market, especially every year going into AEP, and we target the companies we see those members going to. And reach out to members proactively to say, hey, we understand that you terminated your HAP coverage. I actually just had a member yesterday calling into our call center very upset because she found out that her plan had been changed and she had doesn't even remember speaking to somebody. And it was probably just as simple as they confirmed their MBI number to somebody they thought was from Medicare, and really it was somebody at a call center somewhere that was changing over their plans. That's why it's so important. Do not give out your information over the phone unless it's with a trusted agent, a loved one, family member, something like that, because you can't be too careful these days.
Okay. Now, for those reasons that you stated, is that why people aren't able to make changes year round?
Exactly. It protects them from those types of things. And also, it stops them from what I call the shiny toy being dangled in front of them year round, right?
Yeah.
You see a lot of plans out there dangle huge benefits in front of members, and it looks amazing. I mean, we saw Joe Namath talking about them on television all the time, right?
Yeah.
And unfortunately, when you go after those types of things, you're probably giving up coverage elsewhere. So it really allows just that one dedicated time a year for members to be able to know, I'm going to sit down, review all my options, and make sure, is my current healthcare plan the one that still suits me best? Because we know healthcare changes throughout the year. Your prescriptions may change. Plans may change their service area or networks or something else. So it's important to have that one time a year that, I should sit down with somebody, review my plans and all of my options, make sure I'm still in what fits my current needs the best, and then we can move forward from there.
Now, you mentioned that someone should stay with their same agent. What might someone expect when they're dealing with their agent? So what are you hoping that your agent is going to provide to you during that very critical time when you're making a decision that you're going to have to stick with for the entire year?
Yeah, and I do want to clarify, there are some circumstances throughout the year where you can make changes in your plans.
Okay.
So that is important to know.
Okay.
But for the most part, you're going to be in that plan for the year, and if it's working well for you, you don't want to change it because that's a disruption to care, right? You got to give your doctor a new card or something else. But when you're working with your agent, you really want to sit down and make sure that they're reviewing your current prescription drug list, making sure that all your drugs are still covered by the plan in an affordable way. Going over your primary care physician, your specialist, are they all in network? And if they're out of network, what are the cost shares? Is that going to fit my budget every year? And then also they want to be thinking about what they may know is coming up in the current year. Am I going to have a knee replacement in 6 months? Do I know that's coming? Well, then physical therapy is probably something I'm really going to want to pay attention to because I'm on a fixed income. I'm going to have to go 3 or 4 times a week. How much is each one of those sessions going to cost me? The procedure itself, we're all fairly inexpensive for those types of things, but it's those hidden costs like physical therapy that you want to make sure your agents are reviewing with you to make sure that it's going to fit whatever your treatment plan may be that year. And it may be, I know I'm going on to dialysis next year, which is going to usually make people hit their max out of pockets. Well, my most important thing and what my agent probably wants to look at, what's going to reduce my max out of pocket. So it's those types of things that you want to make sure that you're reviewing with your agent, that they're checking on, and they're confirming with you that it's still covered or this is how it is covered.
Okay, well explained. Thank you. Now, as we come to the end, believe it or not, today's show, I would like to give those listening the opportunity to take action if necessary. So where can people who have yet to enroll in coverage for the annual enrollment period go to find more information and access resources?
Yeah, so I'm going to be super biased to start off and tell you www.hap.org/Medicare is a fantastic option to look, but also Medicare.gov is an option for you to look in. You'll see all the plans available in your area, and be able to put in your prescription drugs, see what the potential cost shares are for all of those. But also, if you're not working with a local agent, I'm going to suggest find one, talk to a loved one, see who they're working with, who they trust, because if they trust them with their health care, it may be a chance for you to take a look, and they're going to be able to guide you through that process as well.
Okay, perfect. Well, I want to thank you for taking time out of your day to spend it with me. And thank you so much for providing such critical information for the listeners. I really appreciate you taking the time to do that.
No, thank you for having me in, and thank you for bringing this up to your listeners as well.
Yeah, you're very welcome. All right. Thank you, Cal.
Thank you.
Thanks for listening to Empower It with Angela T. Moore. Feel free to share this episode with someone you think would enjoy it. New episodes come out weekly. Follow our show on Apple, Spotify, YouTube, or wherever you're listening right now.